UVB penetrates the more superficial surface of the skin, that epidermis. It causes direct DNA damage, and it's one of the things that's very responsible for a lot of the skin cancers that we are prone to when we have repeated exposures to UVB. It's the main cause of sunburn, and it's actually what is responsible for a lot of our vitamin D synthesis. And I get it. We love our vitamin D. Let's not get too hype about vitamin D in terms of chronic UVB exposure, because that's what tends to increase our risks of different basal cell and squamous cell carcinomas of our skin. Now, UVA penetrates deeper into the skin. It doesn't directly cause damage to the DNA, but it does cause injury through the form of oxidative stress. And we've talked about this when we've talked about mitochondria and ATP production and different types of oxidation. So UVA penetrates deeper and affects that aspect of our skin. This is what leads to photoaging. So a lot of those signs and symptoms of aging, like the wrinkles and things like that you get from sun exposure, melasma comes from UVA as well. You're also at risk of skin cancer with chronic exposure to UVA, but that form is melanoma. So they both cause different kinds of damage, but they do it in different ways. Wearing sunscreen protects those melanocytes from being overworked. So UV light, just like so many other things, has a dose response associated to it, right? Your body can protect itself with UV exposure up to a certain point. Once you have reached that point, the melanocytes become overburdened, and that's when you start to experience the damage from that UVA and UVB exposure. Welcome to No Filter Doctor, where we cut through the health hype, dig into what's real, what's backed by evidence, and what works. I'm your host, Dr. AK. Let's get into it. Hey everyone, welcome back to another episode of No Filter Doctor. I'm super excited you are joining me today. We are going to talk about a topic that is very relevant given the time of the year, entering summer in the Northern Hemisphere. We are going to talk about sunscreen. And the reason I chose this topic is because there's just a lot of stuff out there about sunscreen causes cancer and what's going on with sunscreen and what's the right type of sunscreen. Also, the FDA is now approving a new compound for use in the United States that has been in European sunscreens for, I think, something like 20 years. So I wanted to talk about all of those things to give you some information as we head into that time of year where a lot of us are going to be funning and sunning. Now, before we get into all of the different types of sunscreen, it's important to first know what's going on with your skin and what are the different kinds of UV light, and getting familiar with the terminology a little bit. The sun radiates two forms of ultraviolet light. There's UVA and there's UVB. They both have very distinct effects on the skin, but cumulatively, their effects kind of overlap a little bit. UVB penetrates the more superficial surface of the skin, that epidermis. It causes direct DNA damage, and it's one of the things that's very responsible for a lot of the skin cancers that we are prone to when we have repeated exposures to UVB. It's the main cause of sunburn, and it's actually what is responsible for a lot of our vitamin D synthesis. And I get it. We love our vitamin D. Let's not get too hype about vitamin D in terms of chronic UVB exposure, because that's what tends to increase our risks of different basal cell and squamous cell carcinomas of our skin. Now, UVA penetrates deeper into the skin. It doesn't directly cause damage to the DNA, but it does cause injury through the form of oxidative stress. And we've talked about this when we've talked about mitochondria and ATP production and different types of oxidation. So UVA penetrates deeper and affects that aspect of our skin. This is what leads to photoaging. So a lot of those signs and symptoms of aging, like the wrinkles and things like that you get from sun exposure, melasma comes from UVA as well. You're also at risk of skin cancer with chronic exposure to UVA, but that form is melanoma. So they both cause different kinds of damage, but they do it in different ways. Okay, so that is the UV exposure to the skin. In the skin, there's terminology that we need to know as well. We have pigment cells in our skin called melanocytes. They sit just beneath the outermost layer of our skin, and when they're exposed to sun, they go into protection mode. They start to secrete a substance called melanin, and what melanin does is it absorbs the UV light that we are getting. And the whole point is to shield DNA from getting hit with that UV light. The other things that melanin does is it kind of goes out and it looks for those oxygen radicals, that oxidative stress that we were talking about, and captures that. It also works to repair some DNA damage that occurs with UV exposure. So when you go out in the sun and you see that you're getting tan and your skin's a little bit more pigmented, that is from your melanocytes trying to save you from that sun damage. And this is something that a lot of the talk on social media about you don't need sunscreen because your body's perfectly capable of protecting itself comes from. Is your body capable of producing melanin? Yes. Your melanocytes are going to do their best to try and protect themselves from that UV light. However, it's not a perfect system. And the more exposure you have, the more chronic exposure you have, the more holes there are for that system to fall apart, which is why a lot of people say wear sunscreen. Wearing sunscreen protects those melanocytes from being overworked. So UV light, just like so many other things, has a dose response associated to it, right? Your body can protect itself with UV exposure up to a certain point. Once you have reached that point, the melanocytes become overburdened, and that's when you start to experience the damage from that UVA and UVB exposure, which leads us to talking about different information about sunscreen. So let's go through some definitions when it comes to sunscreen as well. When you see a label on sunscreen that says broad spectrum, it is saying that it provides protection against both UVA and UVB light. That is the kind of protection that we are looking for. If we're going to wear sunscreen, we want something that will protect us against both of the forms of UV light because, as we discuss, they each do different things and cause different kinds of damage. So we want to protect ourselves from both of those forms of damage that can occur. You're also going to see something on the packaging that says SPF. Now, SPF stands for Sun Protection Factor. Now, there is a rumor going around that says once you reach a certain sun protection factor, you have no added benefit. That is not entirely true. An SPF of 15 correlates with about 93% of UV absorption. So there's still about 7% that is penetrating the skin. If you go up to an SPF of 30, that's around 36.7% of UV absorption. An SPF of 45 gets us up to about 97.8%, and an SPF of 50 gets us about 98% of UV absorption. So you can see there are increases. They aren't incrementally huge. Once you move up in that SPF factor, those increments of change get smaller, but it does still offer more protection. My goal is to have something that is an SPF of 50 or higher. The benefit of the higher SPF is it leaves more room for air. Let's say you just put a thin layer on. Well, that higher SPF is going to absorb more UV, so you have more protection. The other things that you'll see on sunscreen packaging are things that say chemical versus physical protectant. So I want to talk about what those differences are. Physical protectant is often mineral-based. So that means it's coming from either zinc oxide or titanium dioxide. They both offer broad-spectrum UV coverage. They have minimal absorption. So that's another thing that we have to consider. When we're rubbing this stuff on our skin to protect us from the UV light, how much of that is being absorbed through our skin? When we're talking about those physical protectant or the mineral-based sunscreens, they have a very low level of absorption. They also carry a lower risk of allergic reaction or irritation in them. Not to say someone can't be allergic to zinc oxide or titanium dioxide, it's just at a lower rate than some of the chemical protectants. The other thing that I like about them is they are less harmful to marine life. So oftentimes, we're going to the beach and we're out in the ocean. That sunscreen can come off of our skin and find itself into water, and then it can cause a damage to the different reefs and different things in terms of marine life. Those physical protectants are much safer for the reefs and a lot of the different marine life that's out there. Now, the bad side of the physical protectants is they usually leave some kind of white cast on your skin. The white cast does not bother me personally. I'm completely unbothered by it, but there are some people who do not like it. Now, I do have pigmented skin. I'm a little bit darker, but obviously, the darker you are, the more apparent that white cast is. And so that's where some of the chemical protectants come in. They don't have that white cast. But then they do have some other concerns. The chemical sunscreens are often going to have ingredients listed. I'm going to read these to you: avobenzone, oxybenzone, octocrylene, and octinoxate. I had to read that. That was a lot. So those are put in, and they also act as a broad spectrum UV absorbing substance. The issue with those, I guess the main concern, is that they can be absorbed through the skin. And there are studies that demonstrate that with repeat applications, those plasma levels can rise. They also are not safe for marine life. These are the substances that often bleach different reefs. And if you've ever gone on a scuba or a snorkeling trip or something like that, these are the sunscreens that they do not allow you to wear. Now, when it comes to the skin absorption, the FDA says we're unsure of what the significance of this is. And I respect that. I respect the FDA. I don't think it's up to them to find all of the different safety mechanisms of everything that gets produced and manufactured. But I don't like the idea of absorbing chemicals through my skin. I do not like the idea of having plasma levels increase with repeat applications. So that is another reason why I choose the mineral-based or physical protectant SPFs. It's my prerogative. I'm not saying that's what you need to decide to do for yourself, but this is what I do for myself and my family. Now, there is a new kid on the block in the US when it comes to chemical sunscreens. The chemical that is going to receive FDA approval is something called bemotrizinol. It has a pretty favorable safety profile and so far minimally identified dangers. So bemotrizinol is a pretty big molecule and it's not readily absorbed through the skin. So some of the studies that have looked at plasma levels have not been able to find significant plasma levels even with repeated applications. The other favorable characteristic is it doesn't appear to be an endocrine disruptor. We talked about endocrine disruptors when we did our essential oils and candles blog. I actually haven't done a podcast on it yet, so I'm just going to briefly address this. Endocrine disruptors are any kind of agent that can interfere with hormone production. And so one of the things is lavender essential oil. That is a known endocrine disruptor. You're not supposed to diffuse that if you have kids in the house or you have animals nearby. Some of those other chemical sunscreens that I had mentioned are also concerning for possible endocrine disruptors. So you don't want to apply something repeatedly that gets absorbed into your skin that can then interfere with different kinds of hormone production. Bemotrizinol so far does not produce evidence of being an endocrine disruptor. So that's another favorable characteristic of it. Now, one area of concern is that some people tend to have some more sensitivities to this than they do the mineral-based or physical-based sunscreens. So this is an area of concern if you have really sensitive skin, or let's say you have a lot of eczema, you're having skin reactions to things, you get a lot of dermatitis. This may be something that if you wish to try, you probably want to test it on an area of your skin, a small area, and see how your skin responds to it, because there are reported sensitivities of use. When it comes to concerns about marine life and reefs, the concentrations of bemotrizinol are relatively low in terms of what they have measured in Mediterranean waters. Again, this has been around in Europe for about 20 years. So this also seems like it's pretty environmentally favorable. Now, I say that with caution because there haven't been specific studies done on this exact substance and coral reefs. I don't want you to get the impression that I'm saying it's totally safe. Wear it whenever you go snorkeling. That's not what I'm saying. I'm just saying so far, things seem to be okay, but there is no formal study with it. Now, a lot of these sunscreens that I have talked about thus far, I talked about the general application. But what do we do for our face? Obviously, we want to have something that is broad spectrum. We want it to have an action against UVA and UVB. But the other thing that I like for the face is a tinted SPF. And the reason for that is there are studies that have come out that have demonstrated indoor light can cause signs of aging. And those SPFs that are tinted provide a little bit of extra protection against the indoor light that we are exposed to. The other things that are just as important in protecting your face are hats. If you follow me on social media, you see that I wear these really obnoxiously huge hats whenever I'm out in the sun, and that is fine. I have no qualms about that. I already have enough sun damage that I got when I was 16, 17, hanging out at a pool. I don't need any more of that as I'm approaching my 50s. So I wear a huge hat and I also wear sunglasses. So not only do I apply the SPF, but I also have other items that I wear to protect from direct sunlight as well. I'm a rash guard wearer when I'm at the beach, not because I need it for any kind of surfing protection. It's just another layer of protection against the sun. The last thing that I want to address is this chatter about sunscreen causes skin cancer. That is just not true. There is no causal relationship there. Skin cancer has to do with chronic exposure to sun, and it typically comes up years after that repeated exposure. So a lot of times you'll see people talking about whenever SPF use went up, that's when skin cancer diagnoses went up. No. Let's talk about this for a minute. If you are talking about when skin cancer rates went up, you need to go back and look at the skin protection habits of the people who got diagnosed with skin cancer like 20 to 30 years before they got diagnosed. It was whatever they were doing then that gave the highest risk for their diagnosis when it occurred. It's not wearing SPF now. And one of the other reasons that the rate of skin cancer diagnosis has gone up is because of the screening process. We have dermatologists and different doctors that we meet with once a year who do a full scan of our skin and look for suspicious lesions. Back in the day, people were rubbing the Hawaiian tropic coconut oil smelling stuff into their skin to get tanned. And now those people are getting diagnosed with skin cancer. It's not from wearing the SPF. If you are that worried about skin cancer and wearing sunscreen, use the physical protectant just to deal with the white cast that maybe you're not excited about. The truth is, the best sunscreen is whichever one you are going to wear. The key is to actually wear sunscreen, whether it's chemical-based or mineral-based. If you like it and you're going to wear it, pick that. As we head into our longer days in the Northern Hemisphere, I hope this information has been helpful to you and gives you a little bit more clarity on what to do when you are in that aisle with all of those different sunscreens that are available to you. Go ahead and read the labels. You definitely want something that's broad spectrum. Whether you choose to go to a chemical-based or mineral-based one, that's entirely up to you and what else you want to do with that. And we'll see what happens when these Bemotrizanol sunscreens make their way onto the shelves as well. As always, thank you for joining me, and I will catch you next week when the new episode comes out on Monday. Take care, everyone. Thank you so much for joining me on this week's No Filter Doctor. If you enjoyed the content, you can follow me on social media. I'm on Instagram, Facebook, and YouTube. You can also go to www.thewholehumanhealthandwellbeing.com and sign up for the weekly newsletter, where you will get a link to the blog, that week's podcast, and a health tip of the week sent directly to you. It's important to know that while I am a doctor, I'm not your doctor.
This podcast is for educational and informational purposes only, and it's not intended as medical advice. Listening to this podcast does not establish a doctor-patient relationship. The information discussed should not be used to diagnose, treat, or prevent any medical condition, nor should it replace individualized medical care. If you have questions or concerns about your health, please contact your own healthcare provider. Any decisions to delay or forego a medical evaluation or treatment based on the information discussed in this podcast are made so at your own risk. My only financial disclosure is my medical practice, the whole human health and well-being. Take care, and I'll talk to you next week.